Hello, everyone. Let's talk about high blood pressure. Once again, let me welcome you to my channel. My name is Dr. Samson Owen. Now, high blood pressure is what most of us refer to as high BP, and high blood pressure is also known as hypertension. High blood pressure is a condition or a chronic medical condition that results from elevated pressures within your arteries. According to WHO, high blood pressure is defined as a systolic blood pressure that is 140 millimeters of mercury and above, and a diastolic blood pressure that is 90 millimeters of mercury and above. Now, the systolic blood pressure is the pressure in your heart while your heart is contracting, while the diastolic blood pressure is the pressure in your heart while your heart is relaxing. High blood pressure is a public health problem. It's a public health issue because about 1.1 billion of the world population has high blood pressure, and 30% of Nigerians are living with high blood pressure even without knowing, and that is why it is referred to as a silent killer. Now, there are a lot of things that may cause high blood pressure. However, we can decide to put this under two broad categories. One is genetic factor and the other one is environmental factor. Now, genetic factor accounts for more than 90 to 95% of causes of high blood pressure. In other words, we don't even know what these genetic factors are that are responsible for this high blood pressure, which means high blood pressure can be inherited. This type of high blood pressure or hypertension is what we call essential hypertension. The other 5% are usually due to medical conditions, maybe diabetes mellitus, problem with your hormones, problems with your ovary like in polycystic ovarian syndrome, and other medical conditions that are actually treatable. There are other factors too that may contribute to high blood pressure. When you choose an unhealthy lifestyle like smoking, taking too much of alcohol, not exercising, and taking excess salt in your diet, sedentary lifestyle, all these factors contribute to high blood pressure. Preventing high blood pressure involves making healthy life choices such as eating healthy meals, engaging in regular physical exercises, limiting excessive weight, limiting salt consumption, limiting alcohol consumption, and stopping smoking. These preventive measures will help to prevent high blood pressure, especially in those who have the genetic component or risk of having high blood pressure from their parents. For those who already have high blood pressure, if these preventive measures do not work, your physician may need to place you on certain medications, and you may even need to do certain tests to detect if your high blood pressure is treatable. Now, it's important to know that you have high blood pressure because high blood pressure is a silent killer. It really doesn't present with any symptoms until there are complications, until there are organ damage. And what are these complications? Somebody who has high blood pressure without knowing may suddenly wake up one day with visual loss, inability to see. They can suffer from cardiac arrest, they can even have a stroke, and their kidney can even fail, resulting in hemodialysis. So as we can see, preventing high blood pressure is more important than treating it. So if you don't know your blood pressure, it's very important for you to go to a nearby healthcare center to check your blood pressure regularly. Be sure that you don't have high blood pressure in order to mitigate against the complications of high blood pressure. In conclusion, high blood pressure, like I said, is a public health issue, and it's important for you. It's a silent killer, so it's therefore important for you to go to a nearby healthcare center and check your blood pressure. I hope you enjoyed this presentation. If you have comments, please drop them in the comment section. I will attend to them. See you in my next class. Bye.